Hello people, look at this question here. Question number 8, which has been asked in anatomy final exam theory paper. Okay, so this is an A I'm trying to write here. Anatomy theory exam final exam paper asked November 2023 for 5 marks. They've asked this question on the Thenar eminence. So please focus here. A 28-year-old female. So here there's a female. I will just put it in diagram so that I can understand. There's a female here. She's complaining of pain and numbness. Two things, pain and numbness in the thenar eminence of the right palm. So I will draw a right palm here, which is zoomed. Okay, so in this right palm, in the thenar eminence, that is near the thumb, there is pain and numbness. Pain and numbness. Okay, so some vision you have now. What are they asking? Which nerve is affected? What is the distribution of this nerve in the hand? Okay, so there are no other symptoms that they have explained. So specifically, if the thenar eminence is affected, that means the supply to only the thenar muscles seems to be affected. Okay, let's look at this. First, you give yourself an imagination of this question. So this type of diagram, right palm, thenar eminence, this person has pain. Okay, so first of all, that vision, that small diagram, if you draw by the side in the paper, in your answer paper, that would be good. Okay, now let's get started. So look at this hand. Okay, this hand, you should know how the supply is coming. So here you have the median nerve. Okay, so I'm getting it directly into this. So here you have the median nerve which is coming. So it is mostly going under the flexor retinaculum. But there is one small portion which is a branch, that is the palmar cutaneous branch, which is above the flexor retinaculum. So this is palmar cutaneous branch is superficial to the flexor retinaculum. So it's written here, you can see. Correct? So this one is supplying the skin over the thenar eminence. Okay, so it is supplying the skin over the thenar eminence. This is the most important point in the textbook that you had to focus on for this exam, for this question. Okay, so the answer that you will write, which is the nerve that is affected, is the palmar cutaneous branch, that is C6 to C8 part of the median nerve, because median nerve has C5 to T1, but here they are talking only about the C6 to C8 palmar cutaneous branch. Okay, which lies superficial to the flexor retinaculum, which is supplying the skin over the thenar eminence. This seems to be affected. Okay, that is why there seems to be pain and numbness over the thenar eminence. Okay, this seems to be affected because if the thenar eminence muscles were involved, then there would have been problem with the action, but that they have not mentioned here. Okay, we'll come to that. Okay, and if it was a carpal tunnel syndrome, then what would have happened? You would have had compression because of the flexor retinaculum, and all these fingers would have had problem, right? All the fingers also and the thumb also would have had problem, but they have not said that these fingers have problem. You understood, right? The fingers are all fine. The movement of the thumb is fine. So they're just saying some pain and numbness. But now let us say the pain and numbness is coming deep muscular itself. That also can happen, right? So in case that was the issue, then you could have said that this branch of the median nerve, which is supplying the thenar muscles, could have been affected. But motion as such of this movement of these muscles is not affected. That's what I'm understanding from this question. However, you can say the thenar eminence is because of these three muscles, that is the flexor pollicis brevis. Take a break, I understand. Abductor pollicis brevis and opponens pollicis. Okay, so the thenar muscles are the flex the thumb, yes, bring the thumb, flex the thumb, yes, angle if you reduce of the thumb, that is flexion, right? Then abduct the thumb, that is take it away from your body. Okay, that is abductor. So it is actually abductor pollicis brevis, and then you have the opponens pollicis, the opposition action of your thumb also you do. Okay, so remember here it is the abductor, the opponent, but the flexor is reducing the angle of the thumb. So that one. Okay, so these are the three muscles of the thenar eminence. So if the muscles are affected, then it should be the one which is coming under the flexor retinaculum. That time it could be a carpal tunnel syndrome. So see, if this portion is affected and only this portion is affected, then it should be some problem nearby. Okay. Otherwise, if something above is affected, then everything would have been affected, which they have not explained in the symptoms. So if there is compression of the median nerve because of the flexor retinaculum, then you have this carpal tunnel syndrome where you will have problem with these three fingers, sensory loss, and lot of other motor loss also can be there. Okay. Then there can be wasting of the thenar, eminence, ape-like hand, etc. But I think this is not what they are focusing on. So what will you say in the answer? Palmar cutaneous branch C6 to C8, superficial to the flexor retinaculum, supplies the skin over the thenar eminence. Okay. Now you have to draw this diagram, otherwise you will not get marks. Practice this diagram now. Very easily we will draw this diagram quickly. Thumb, finger, 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 draw one flexor retinaculum, green, label as flexor retinaculum, draw the nerve here, bring the nerve underneath, put three branches here, then give branch to the finger, three of these fingers, then show one branch which is coming above the superficial, above the flexor retinaculum, label this. This is the main focus here. Palmar cutaneous branch of the median nerve, C6 to C8, label this as median nerve. Okay, that's it. And here you have to label this as the thenar eminence. And you can write here the muscles also if you want, you can label. And then you should say this is the right palm. Okay, anterior view, like that you can write.